Hey there, healthcare professionals. Today let's dive into the key MRI findings in subarachnoid hemorrhage. As you know, a subarachnoid hemorrhage, or SAH, is a critical condition requiring swift diagnosis and treatment. So let's break down what you need to know. First up, the basics. In the acute phase, blood in the subarachnoid space appears hyperintense on T1 weighted images and hypointense on T2 weighted images. This is due to the high protein content and paramagnetic effects of deoxyhemoglobin. It's crucial to recognize this quickly as it guides immediate management. Now let's talk about flare sequences. Fluid attenuated inversion recovery helps in identifying subtle subarachnoid hemorrhage by suppressing the cerebrospinal fluid signal, making the blood appear hyperintense. Keep an eye out for these changes, especially in the basal cisterns and cortical sulci. Moving on to gradient echo and susceptibility weighted imaging. These sequences are particularly sensitive to blood products even in minute quantities. You'll see blooming artifacts in areas of hemorrhage, which can be pivotal in detecting microbleeds or small hemorrhages that might be missed on other sequences. Next, let's consider the chronic phase. Over time, blood products evolve. Hemosiderin deposition can be seen as hypointense signals on both T1 and T2 weighted images. This indicates the chronicity of the bleed and can help differentiate old hemorrhage from new. Also, don't forget about the role of MRI in identifying complications. Vasospasm, for instance, is a major concern post-SAH. Diffusion-weighted imaging can reveal areas of restricted diffusion, indicating acute ischemia secondary to vasospasm. Monitoring these patients closely with MRI can be life-saving. Lastly, gadolinium-enhanced imaging can be useful in certain cases. It helps in identifying vascular anomalies like aneurysms or arteriovenous malformations, which might be the culprit behind the hemorrhage. Consider this when the etiology of SAH is unclear. So, to sum it up, look for hyperintense signals on T1 in acute phases. Use FLAIR to highlight subtle hemorrhages, rely on gradient echo for sensitivity to blood products, and monitor chronic changes with T1 and T2 hypointensities. And always be vigilant for complications like vasospasm with diffusion-weighted imaging. I hope this quick overview helps sharpen your diagnostic skills. Being adept at interpreting these MRI findings can make all the difference in patient outcomes. Stay sharp, stay informed, and keep making a difference. Catch you next time.